Welcome back to OMFS Essentials. In our previous episode, we detailed the design and preparation of the surgical environment. We established that the OR is a controlled system of zones, air, and surfaces. Today, in part 2, we focus on the human element, the meticulous preparation of the surgical team and the patient, and the correct procedures for degowning and degloving. 1. Preparation of the surgical team. A. Surgical attire. Before entering the semi-restricted area, all personnel must change into scrub suit, clean, sterile laundered scrubs, cap, it must cover all hair, mask to cover the mouth and nose, footwear, dedicated OR footwear made of rubber or plastic, which is washable. Leather is not desirable as it cannot be washed and can harbor fungal growth. B. The surgical scrub, or hand scrubbing. This is the most critical step for the surgical team. The goal is not to sterilize the hands, which is impossible, but to make them surgically clean by removing dirt and drastically reducing the microbial count. Prerequisites. Nails must be trimmed and rounded. Method. The time stroke method. Time, approximately 3 minutes. Strokes. Using an antiseptic soap like povidone iodine or chlorhexidine scrub, 20 to 30 strokes are applied to each site: nail beds, skin creases, and surfaces of the hand and forearm. Direction. The scrub proceeds from the fingertips down to 2 centimeters above the elbow. Key position. Throughout the entire scrub and rinse, the hands must be held higher than the elbows. This ensures that water runs from the clean area, hands, down to the less clean area, elbows, never rolling back to recontaminate the hands. Equipment. Scrub sinks must be wide and deep to prevent splashing. Taps should be doctor's taps or arm-operated, or ideally pedal-operated for hands-free use. C. Gowning and gloving. No-touch technique. After scrubbing, hands are dried with a sterile towel. Gowning. 1. The sterile gown is folded inside out. 2. The surgeon picks it up, touching only the inside of the gown. 3. They slide their arms in and an assistant ties the back. 4. The front of the gown, from chest to waist, is considered the sterile field. Gloving. Open method. With the bare right hand, pick up the left glove by touching only the inside of the folded over cuff. Slide the left hand in, leaving the cuff folded. 2. With the gloved left hand, pick up the right glove by sliding the fingers under the cuff, touching only the outside of the glove. 3. Slide the right hand in and unfold the cuff over the gown sleeve. Finally, use the gloved right hand to slide under the cuff of the left glove and unfold it over the left gown sleeve. 2. Preparation of the patient. This is a 2-phase process. A. Preparation in the ward or preliminary. Hygiene. The patient should have a good bath to clean the body. Part prep. The surgical site is washed thoroughly. Shaving. Hair should be removed at least 12 hours before surgery. On-time shaving can create micro-scratches on the skin, which break the barrier and allow germs to enter. Oral cavity prep, OMFS specific. This is vital. The oral cavity must be inspected for any septic foci, carious teeth, infected pockets, or calculus, which should be treated or removed. Antiseptic mouthwashes are prescribed to reduce the microbial load. B. Preparation on the operation table or final. This is the final step before the incision. Scrubbing. The surgeon or assistant vigorously scrubs the surgical site with an antiseptic soap solution. Critical direction. The scrub must start from the center, the incision line, and move to the periphery. A swab that touches the periphery is considered contaminated and is never brought back to the center. it is discarded and a new one is used. Painting. After scrubbing, the area is mopped and painted with an antiseptic solution like 5% povidone iodine. Draping. The prepared surgical field is now isolated from the rest of the patient's body and the environment using sterile surgical towels and drapes. 3. Removing gown and gloves. Proper removal is essential to protect the surgeon from the contaminated gown and gloves. A. Degowning. Gown is removed first. 1. A circulator unties the back of the gown. 2. The surgeon grasps the gown at the shoulders and pulls it downward and off the arms, turning it inside out as it goes. 3. The contaminated outside is folded inward and the gown is discarded. B. Degloving. Glove to glove, skin to skin. 1. Glove to glove. Use the gloved fingers of the right hand to grasp the outside cuff of the left glove and pull it off inside out. 2. Skin to skin. Slide the ungloved fingers of the left hand under the cuff of the right glove, touching only the clean inside surface. 3. Pull the right glove off inside out, trapping the first glove inside it. Discard and then wash hands thoroughly. Summary. Aseptic technique is a meticulous step-by-step process involving both the environment and the people within it. Today we covered surgical attire, scrubs, caps, masks, and washable footwear, surgical scrub, the time stroke method, keeping hands above elbows, gowning and gloving, the no-touch technique to establish a sterile field, patient prep, the 12-hour shaving rule, and the critical center-to-periphery scrub, degowning, removing the gown first, inside out, degloving, the glove-to-glove, skin-to-skin technique. Asepsis is not one single action, but a chain of correct procedures. A single break in this chain, from a ceiling fan to an improperly removed glove, can compromise the entire surgery. You've been listening to OMFS Essentials. As always, keep mastering the essentials.